Hi, good afternoon, everyone. How are you guys? How are you doing all? So, shall we start? Hi, Sharanya. Good afternoon. How are you?
Hi, good afternoon. I'm good. How are you?
Yes, all good. So, I think we should start.
Yeah.
So, guys, you're welcome to the exclusive webinar on nutrition and diet before and after the heart attack. And as the name says, we are going to talk about the precautions in the healthy volunteers, in the healthy human beings to avoid the heart attack, to avoid the myocardial infarction. And we'll be talking about the post heart attack as well, like what to eat and what to maintain. So to discuss that, as you all know now, Ms. Sharanya Sastry, she's with us from New Delhi right now. So Sharanya is a preventive clinical nutritionist with a special interest in sports nutrition, and she is a published author for newspapers like Deccan Herald, Bangalore Mirror, New Indian Express, and magazines like Femina and India Today. And she has conducted multiple corporate webinars and many conferences as well, many webinars for us as well. You have seen, and she holds her double masters in sports nutrition from ISST Pune and dietetics and applied nutrition from the renowned Manipal Academy of Higher Education, Udupi. And she is also certified in bariatric nutrition and diabetic education. So her areas of interest are recovery from the sports injury, importance of nutrition among athletes, especially in women. She has had hands-on experience on nutrition intern at St. John's Medical Hospital and a student at Kasturba Hospital, Manipal. So she has multiple memberships. So a lot to say about her. But as looking at the time, we will not delay, and I will hand over the session to Ms. Saranya. Thank you, Saranya.
Yeah, thank you for that lovely introduction. Good afternoon, everybody. I think without much delay, I would quickly start off. Um, so just let me know if once the screen is visible.
It is. Okay, you please open the...
Yeah, I'm just opening, yeah. Yeah. Is it all clear and visible?
Perfect.
Yeah.
Perfect.
So nutrition, when I was given this topic, especially the cardiac part, most of us keep thinking does it really have any connect? Because unnecessarily people these days keep linking food with anything, right? I mean, that's what most of us think, that most of the times it's not even connected, and maybe it's a fad, because so many times for everything they come up with so many, we have so many WhatsApp messages, so many things circulating, that we really don't know if it even has a connect, and if yes, then even if it's scientifically proven, and if there is any scientific studies and research studies done on that. Heart is something which I think very easily we say that it broke my heart, he broke my heart, she broke my heart. And I think food and heart are really very closely connected, because both are very emotions based. You cannot really combine, or you can't really talk about food and your heart, because both of them don't really understand logic, because hunger is also one such thing, and heart is also one such thing. So pre and post heart attack, so it's very important that we have this food heart connect intact. So the first very slide, I mean the introductory slide, not to just scare you, but this was a fact that I saw on one of the websites, that 9.5 million deaths, among that, which is one in six deaths worldwide, which occurs every year. And in that, over three-quarters of these deaths takes place in the home, and more than half of them don't even have a certified cause. So I'm talking about heart attacks which happen at home and we don't even know the cause, right? So many times we have so many film stars, we have so many celebrities, influencers, who appear so fit, who appear so healthy, but still we hear that, they died of a heart attack, right? So this is, the main problem, because the causes are going unnoticed. But what are the underlying causes which go unnoticed, and what are the things from the nutrition perspective is what, we are going to talk today. So food heart connect, like I said, food and heart both are emotion based, right? Because we don't really connect with logic when it comes to food. How many of us really say that we always think logically while eating? Maybe one day or 2 days, or maybe a week, or maybe 2 weeks. And that is where I think most of the diets fail, because there is no emotion which is considered when you're planning a diet plan. And that is why when we have conferences and we talk to our dietetics fraternity, we talk about having compliance from the person or the patient's routine. Because when you make a diet or design a nutritional plan, it's very important that you keep in mind certain factors like their religion, their belief, their customs, their compliance, their cuisine, their region, all of it. So food heart connect is also something like that, where uh, definitely it is connected. Your heart health is definitely connected to the kind of food that you eat. So simple things, I think these two lines are more self-explanatory. Hypertension, smoking, obesity, and physical inactivity accounted for 80% of the stroke cases. So this is the data that I have picked up from WHO. So yeah, that why hypertension, why smoking, and obesity, and physical inactivity, all of these. So all of this somewhere comes down to the food that we eat. Android is more prone to CVD as compared to gynoid form of obesity. So for all of you who don't know what exactly is android obesity is somewhat like an apple-shaped obesity, where you have more of fat accumulation near your abdominal region or the belly region. And the gynoid obesity is morely, it's seen in women, where it's a pear-shaped obesity, where you have more of fat accumulation around, your waist and your hip region. So android obesity is basically the thin fat Indian concept, where we see especially Asians, where we actually have a thin structure. We are quite narrow, but when you look at the obesity or the fat accumulation, it's always that we have that big fat belly. So the region where you have your abdominal organs, that is the most important region, that's your vital organs, and the more fat accumulation in that region is always making you prone to CVD. So yes, we all know that belly fat, abdominal fat is directly related to the kind of food that we eat. And I'm sure all of you here by now know that there is nothing called spot reduction when it comes to losing weight. So a lot of us do only abs exercises, only shoulder, or only leg exercises. There is so no such exercises which only makes you lose weight from one particular region of the body. It's the entire body composition and the entire body toning that happens. So food and heart definitely are connected emotionally, psychologically, physiologically, every possible way. So we are discussing about atherosclerosis, why and how. So nutritional perspective to avoid a myocardial infarction, salt and fat control, dietary precautions post a heart attack, and prevention, what I see from a nutritionist point of view. So CHD, the major forms of coronary heart disease. So coronary system, I'm sure all of you know, it basically consists of the heart, consists of the, arteries, the vessels. Basically, it involves with all your circulatory mechanisms. So we have many forms here. As you can see, it starts maybe with a simple hypertension or dyslipidemia, and atherosclerosis, angina pectoris, myocardial infarction, congestive heart failure, and rheumatic heart disease. But here, I think the first three are of really very important to me, because that really starts off with the basic, these are like the basic things with food, with lifestyle, which starts off. So dyslipidemia, abnormal lipid levels, I think most of us know, cholesterol variation, LDL being more, HDL, which is the good cholesterol, is less. VLDL is high, that's what, any change in these lipid profile of yours is nothing but DLP, which is dyslipidemia. Hypertension, I don't think I have to explain, because we so commonly use this word, my blood pressure is raising, I'm angry. So it's connected. So we all know what is hypertension. So when your blood pressure is normal, then when it's higher than the normal range, but why it happens, that we'll talk about it later. And then coming to the main topic that here I'm talking about, which is atherosclerosis. So thickening and narrowing of walls of the blood vessels caused due to elevated lipids and cholesterol. So atherosclerosis is something which does not happen overnight. It does not happen like, with 1 or 2 days, or it does not happen in a week. So when it's a chronic thing, and it's, a chronic, stress that the body is undergoing. So initially it might have started with DLP, that is dyslipidemia, or obesity, or basically whenever somebody is abusing their body over weeks to months to years, depending on how strong your body is and how much it can tolerate. It's like you're stretching an elastic band. So it depends on the elasticity. So the day, it gives up, that day you start seeing things like, atherosclerosis. If you're lucky enough, you get detected, but so many times, it directly ends up in a heart attack, and then, it's over. So this is the picture where I would like to explain atherosclerosis. So when I meant here about, the thickening and narrowing of the blood vessels, so this is one beautiful picture that I picked up. So here you see that, the nomenclature, main histology, and you see in the first decade, right? So you see the initial lesion. So you see that the blood vessel is quite big here. You see it's, the normal blood vessel in the heart. And then you have, as you progress, like, from the first decade to the third decade to the fourth decade, if you're lucky enough, if you have that strong body which is tolerating, and if you have such a good lifespan, then you see that there is this deposition of plaque here, that is nothing but the fat content. So this plaque or the fat content, like I said, does not happen in one day. So initially it would have started off with variations in your cholesterol levels, in your HDL, LDL, obesity, you not losing weight, you being constantly on obese or overweight side. And this kind of, fat thickening or deposition happens. And then gradually over the years, when you see, then you see that, there are different stages. So this is the most complicated lesion at the end, obviously, which you can see. And then before that, you have something called the fibroatheroma, where you have like lipid cores, and before that atheroma. So basically it is a progression. Okay. And how quickly it progresses depends on your lifestyle, depends on the food you eat. So for some people, it can take 10 years, 20 years. For some people, it can happen over, 5-6 years. Also, not to forget, it depends on your physical activity levels and your mental health. Stress is one of the major causatives, which I'll be mentioning about it later. So basically, this is what is called, atherosclerosis. So this phase is where, it's clinically silent. You don't really see much of, your symptoms, where you're just maybe on the obese or overweight side, and you're not taking your cholesterol levels that seriously. But later, when you reach this phase where, the thickening is happened, and you have plaques, and it's totally, the walls are getting blocked, that is when you can start seeing symptoms, and then you will have all the clinical symptoms, and then you might end up in a heart attack. So just a simple picture. This is the normal artery, and this is the artery with the plaque. So you see that there is, problem in circulation, and then we know what happens later. So this is what is atherosclerosis, in a simple way to put it across. So what is my role here, or what should we understand from the nutrition perspective? So this slide, this picture is really very explanatory in itself, but maybe it's too complicated when you just look at it, for the first time. I really picked up this beautiful picture from, I put the reference here. It's from one of the research papers. So there was a lot of research that was conducted on each and every minor micronutrient of the food that we eat, and which is connect with the nutrition and atherosclerosis. So basically, any atherosclerosis, before it progresses to atherosclerosis, it starts off as an inflammation inflammation. It's basically a kind of, oxidative stress in the body. The oxidative stress could either be due to obesity, the kind of lifestyle, the kind of, the food that you eat, everything. So here you see that they have considered so many factors like vitamin C to folic acid to B12 to all the factors and their effect on, this inflammation, or how much it can decrease the inflammation, or how much is it increasing the anti-oxidative species, or how much is it decreasing the reactive oxidative stress, how much is it increasing the HDL, all of this. So looks a little complicated, but then the simpler version is here. So the first thing that they have understood is phytosterols. So phytosterols are basically found in food and which are mainly derived from plants. And there are more than 250 types of plant sterols that have been, recorded. So these phytosterols are very significantly known to reduce the level of the LDL. So basically, to prevent atherosclerosis from the nutrition management, you will basically have to completely keep your cholesterol or your lipid parameters under control. So phytosterols are again of two types, just for the information, if someone is really interested. There are of two types known as plant sterols and plant stenols. So basically they're plant sources. So one of the interesting study that I have put in here is the study compared between yogurt with phytostenol esters, which was 4 gram a day that was given, and low dose yogurt, which was just 2 gram a day. And after 4 weeks of observation, it was found that it effectively reduced 10.3% of LDL C level in patients with hypercholesterolemia. Okay. So it means that you don't really need a separate pill. You don't really need a magical pill or a supplement to include phytosterols in your diet. So simple sources of your phytosterols are here, which I've mentioned. I mean, these are the overnight soak peeled almonds. Your lentils are also, all your lentils, different varieties of lentils, whether it's rajma, whether it's any kind of beans, kidney beans, hyacinth bean, you name it, all the lentils, chole, chickpea, cowpea, lobia, all these lentils, and certain fruits like, passion fruit or your oranges, all these are basically the sources of phytosterols. So, and yes, home set curd or home set yogurt is also one. So we have a lot of myths when it comes to this, hard fat intake and all of that, which I'll be talking about it later. So basically one of the first superfood or one of the main foods that can lower your LDL levels, because we need to address it from a base. You cannot just directly address atherosclerosis, right? We need to first start from the base. So for that, the first one is phytosterol. The mechanism, I don't want to dwell too much into the mechanism. Maybe in 2 lines, I would like to say that the main mechanism of how they reduce the LDL levels is basically they kind of reduce the cholesterol, the way in which it's absorbed in the intestine. So that mechanism, the amount of how it is absorbed in the lumen of our intestine is changed, and that is the chemical reaction and the chemical part to it. I don't want to dwell too much into the technical part of it. So yes, number one, what you need to remember to include or to have in your diet is phytosterol. So second one is the vitamin E. So I think all of us know vitamin E. Most of us might be taking vitamin E supplements. So in vitamin E, you have something called tocopherol alpha T, which is the active isomer, which is again known to decrease your LDL levels, and it is also known to increase the HDL levels. And like all of us know, vitamin E is a fat soluble vitamin. So it's mostly present in nuts, it's present in seeds, it's present in, certain dairy products. And then the very interesting part comes to polyphenols. So polyphenols basically consists of two kind of, basically they are into two categories. One is, as you see, resveratrol and flavonoids. So again, there are many further subdivisions into this called isoflavones, anthocyanins, flavonols, flavanones, and many more. Okay, so basically I think all of us, what we know is what we are familiar in the market, or what we keep seeing very often is all your peanuts, grape extracts. So these things come under your resveratrol, which is a non-flavonoid polyphenol, and which is known to reduce LDL. So most of these supplements, most of the things that you might see as a part of your green tea or lemon tea, or even when you buy something which is heart based, or anything which is pro heart supplement, you will see all these polyphenol extracts. And similarly, isoflavones are also on a rise. So these isoflavones are again present in soybeans, and that is why they have anti-atherosclerotic properties, because their structure is similar to estrogen and it binds to estrogen receptors. But again, having said that, this is only in the case of if someone is having a heart issue. But soya again can be contraindicated in people who are having breast issues and who are on cancer treatment. So that's a totally different thing. So consumption of soybean, according to this research paper, with isoflavones can reduce the LDL. But again, it depends on how, in which way you're consuming the soya. And if it's a fermented soya, then that is much better, because fermented soya is called miso. So they are also a source of vitamin B12. And of course, the method of cooking matters. So I think polyphenols are the ones which are really upcoming in the pharmaceutical market. And even the people, of late, I see a lot of people buying these supplements, which are mostly polyphenolic based. So omega-3 polyunsaturated, I don't think I should, even talk about it. So I think ever since we have heard of heart and, cardiac issues, we have always been given omega-3 supplements, fish oil supplements, and all of that. But omega-3, the main important thing that one I would like to, bring into your notice is they really they reduce the ROS, which is the oxidative stress. So one of the trials that was done here, the research trial says that a high dose of omega-3, that is pupa, can significantly improve the prognosis of CVD, especially the use of 4 grams per day of ethyl icosapentaenoate can reduce the occurrence of cardiovascular events and reduce the risk. So everywhere that I'm talking about here is all the prevention. That is what we need to observe. So these numbers, the numbers that I've put here, the research, they all talk about prevention. So the things change once, you have already got a heart attack. So these numbers have to be very clear, especially when you're consuming this supplement in terms of a supplement or a powder. You need to be very sure about the dosage. You just cannot have an overdose of this. And vitamin B again plays a major role. So vitamin B again has so many subvitamins. We have niacin, we have riboflavin, we have B1, we have pyridoxine, all of this. So vitamin B levels are really known to cause a big change in, preventing one from having an atherosclerosis or a heart attack. So that's why it's very important that you monitor these vitamin B levels, especially B6, B12, and B3. The serum levels have to be maintained or monitored, and because they're of great significance. And similarly, even vitamin D, E, like I was talking about, so that you prevent a CVD or, an atherosclerosis or a heart attack in the earlier stages. Okay, so this is all from the nutritional perspective. There are also other perspectives which I'm not really talking about here, which is, they're basically divided into the modifiable risk factors and the non-modifiable risk factors. Modifiable risk factors include your diet and nutrition, your psychology, and your behavioral aspects. I'm not really touching upon the behavioral and the psychological aspects, and I'm only sticking to the nutrition or the diet part of it. But the non-modifiable risk factors, which is your age, your gender, your ethnicity, your family history, the body type that you carry, especially if you are already, if you, like an ectomorph or a mesomorph or an endomorph, meaning that if you're already a very, by naturally, inherently, you belong to a little, overweight family, or you're naturally overweight, or you're by birth, very thin, very lean, or you are intermediate, between this lean and, overweight. So all these are the non-modifiable risk factors, which also have to be considered, and they also have to be addressed in a different way. So whenever you're talking about a diet to someone, it cannot be the one size fits all. I think this is something that I tell in every talk of mine, that there cannot be one, okay, give polyphenols to everybody or just recommend some isoflavones to someone. So all these factors, the modifiable and the non-modifiable, have to be, put in together. And it's just like, you're just stitching a dress for someone. So you need all the measurements, everything matters, right? So moving on, we have the main thing, that is myocardial infarction. So I'm sure what myocardial infarction, all of you know, it's nothing but a heart attack. So how to avoid from a nutrition perspective? So the biggest picture that you can see on the left is this, android obesity that I was talking about. And in between, you have the heart attack due to whatever reasons I told, whether it's lifestyle, whether it's behavioral, it's psychological, the non-modifiable risk factors. And you also have the mental health coming in. So when I was practicing in Bangalore with Apollo, so I had this one patient who was totally fit, who completely did not even, fall into the overweight category, who had a very clean diet. Okay, who he was not, he was a teetotaler. I mean to say, not an alcohol consumer and not a, smoker, and a very active lifestyle of his. But the only problem was his stress. He was in a very highly stressful job. So it was so surprising, to the cardiologist and to us from the nutrition fraternity, that only stress could, gave him a heart attack, and it got detected. So he was lucky, but still he had to undergo 2, stunts. So it's not only about what you eat. Sometimes it's also about the mental health, that you carry, the stress that makes you eat more, that makes you eat less, that makes you sleep more, sleep less. So first thing, what can you do to avoid MI? Simple thing is wait it out. So I always tell my, people, whoever consult me, that it's not always about the weight that you carry, right? So we are so obsessed with our weight that we always want to, we keep weighing ourselves 500 grams less, 500 grams more. We are worried about, our weight. So it's not really about the weight that you carry, because weight is definitely not an indicator of your health, your fitness, and your, I don't know, what can I say? Maybe it's not even an indicator of anything that about your body composition, nothing. So off late, what we look at is nothing but the waist is to hip circumference, or the waist is to hip ratio. And it's not the BMI anymore. Especially, if you're a sports person, then it's a different ball game altogether. But even for a normal person, there are revised recommendation which says that please look at the waist is to hip ratio, because Asians as such, we are prone to have abdominal obesity. We all are that, the thin fat Indian. So waist is to hip ratio of 0.8 for women, okay, and 1 for men indicates that you're healthy. Okay, so I think there's that small correction in the slide that I've missed out on the WO. So the 0.8 is for women. Okay, so when you measure your waist circumference divided by your hip circumference, when that ratio is 0.8 for a female and 1 for a male, that, clearly states that you're free from stubborn belly fat. Okay, so when your waist is to hip ratio is in that particular range of 0.8 or 1, then automatically I'm sure that you will not be an overweight or an obese person, right? So for that, how do you really weight it out? So include a teaspoon of homemade ghee for a narrow waist and for satiety, because I see a lot of them don't even consider, ghee, and they don't, have the intake of curd and buttermilk in their diet because someone has told them not to have it because they're fattening. So we also need vitamin A, D, E, K, which are fat soluble vitamins in our diet, and we need healthy fats. Okay, but we are okay with eating a chocolate or maybe a pastry as a cheat meal, but we don't really like the ghee in our carrot halwa. This is what I keep telling in every talk of mine, right? So we are so biased. So gods guard you. So for any god-based preparation has to be included thrice a week if you have a family history of heart problems, and if you're on the overweight or the obese side, or if you're even trying to lose weight. So bajra khichdi or jowar roti, depending on the region that you come from, be it south or north. So once in 2 days, they give you, that fitter waist that you're looking for, and they make you slimmer. So simple ways how you can, when I say, when I tell people to use gods, they don't really like it. because nobody likes, Karela, nobody likes Loki. So you can still be very creative, like Loki ka paratha is one such example here. You can have, Dalia ka poha. So you just have to be creative. You just have to have that mind to, include everything in your cuisine than cutting them off your diet. So that is the first one. Wait it out, right? And more focus on WHR than your weight that you want to really see on the weighing scale. So the four S's, okay, the strength, stamina, stretch, and sleep. Most of us, we say that we are physically working out, we walk, we do 10,000 steps, we do 25,000 steps, but there are four aspects to our exercise routine, which all of us have to include. Well, very good if you're working out on your stamina, you're walking for so long, or you're dancing, or you're swimming. But what about the other three, which is strength, which is stretching, and which is sleeping? Sleeping is the most important of all. How many of us can even, like, confidently say that we sleep very well, and we have a very sound sleep without any disturbance, without any mental health, trouble, and we sleep by 10:30 p.m. and we get up by 6 a.m. Like, how many of us can be that confident and say that our sleep routine is so fixed? If you're that confident, then well, that's great. So sleep is something which is like a rejuvenation for all of us. It's maybe very undervalued, or it's not really spoken about, but sleep really adds on to your recovery and to your good heart health. And when it comes to stretching and strengthening, all of us do the stamina based exercises, which is mostly the cardio exercises. We are either walking, jogging, running, but we're not really doing the strength training, or maybe we are doing one of it. Like, either we are strength training and not doing the cardio exercises. But along with that comes stretching, because when you have the stamina, the strength, and the stretch in place, then you have a total overall body workout, and that is when you lose that stubborn belly fat, and that is when we don't have that abdominal obesity. A lot of them ask me, what can I do, what can I eat to not have this abdominal or the belly fat? So it's nothing but the four S's. It's nothing but sleeping on time, eating, yes, nutritional discipline is a next topic, but stretching, stamina, and strength, all of them matter. And by strength, I mean, I'm only not talking about the physical, strength training that we do. It's also about your mental, strength that you have. Like, how stressed are you mentally? And maybe that's not my area of expertise. That is a different topic altogether, but that also is a major factor. Then comes to the main thing, which is your nutritional discipline. So this is the first thing that I saw. This quote really appealed to me. So hunger is the first element of self-discipline. So if you can control what you eat and drink, then you can control everything else. Because, everybody, I think we all do everything for ultimately, basic bare minimum things, which is, food, clothing, and shelter. So I think food is number one. So whatever, however rich you are, however busy you are, or however poor you are, I think food is something which is common to all of us, right? So food is something which keeps us going. How many of us, can even live without skipping our meals? Or how we all get grumpy, right? We don't eat one meal a day, we skip one meal, or we're not, the breakfast is not made tastier, it gets us angry. We don't get a good meal, then, we're all agitated. So food really decides our emotions and, the way we behave also. So how compliant are you with your workout? So that's the first question. So whenever I talk about, heart health and trying to prevent one person from having a MI or a heart attack. So these are the questions that we need to ask ourselves. We don't really need, so many supplements or so many readings on WhatsApp to so many social media stuff. Simple questions, but which give you the right answers. So how compliant are you with your workout? Because all of us are, busy trying to lose weight. We all want to be a fitter version of ourselves, and that's very good. We all want to look young. We all want to, just don't want to reveal our age. We want to age backwards. But how compliant are we with our workout? If you're over exercising or under exercising, then both of them are not good. If you are, postponing your exercise from today to tomorrow, to maybe tomorrow evening, to day after tomorrow morning, then maybe either you're over exercising, or you're under exercising, or you're not eating well. right? So how compliant and how consistent are you with your workout, right? You don't have to work for like 2.5 hours in the gym, or you don't have to burn like calories for 3 hours. You just have to be consistent. Second one, do you skip meals or do you binge eat or stress eat? So how many of us really want a coffee when we are really angry at our boss? How many of us really feel like eating a chocolate when we have had a fight with our partner or a boyfriend or a girlfriend, right? So this is what decides this kind of impatient eating, or the impulsive eating, or the stress eating, or not eating. I see a lot of them not eating at all. When they are stressed, they're not happy with something, they just skip meals, right? So, or even due to work, I think that really applies to all the doctors and the medical fraternity, where they're so caught up, they have so much of work that they don't even get time to eat their meals, right? So this is the second aspect to your nutritional discipline. So how often are you doing this? How often are you binge eating? How often are you eating in the midnight? How often are you skipping meals? So that is also one of the deciding factor. Are you constantly tired? Because I see a lot of people are so much on a diet always. They always want to lose weight. They always want to look young. They always want to, be a better version of themselves, but they're constantly tired, right? So what's the point of being constantly tired when all you have to do is be as fit as a fiddle and be as energetic as possible? So if you're constantly tired, that means that your diet or the food that you're following, the pattern is really bad. Do you need a reminder to drink water or an alarm to wake you up? Because I think I've seen people who have water reminders, right? Like, I don't know, I just can't comprehend to that. Like, why do you need someone to tell you how much water to drink and when to drink water? Don't you think it's something natural? Like, the thirst, hunger, emotions, all of these are very inherent, right? You don't really need someone. And if you have become like that, then probably you're getting, programmed like a robot. So it means that you're not letting your circadian rhythm or the biological clock function, and you're depending. So basically you're biohacked, right? Like somebody else is telling you what to do and what not to do. Similarly, an alarm to wake you up. So you don't really need an alarm when your biological clock is in place, right? Like you have olden days people, these old people, they just get up at 5:36 in the morning. They don't need an alarm. They say that it's a habit. So, well, habit is formed in the later stages, but initially your clock is so good that you automatically feel hungry at 1 p.m. for lunch. You're automatically sleeping by 10:30. You're automatically getting up at 5:36 in the morning. So yeah, it means that you are allowing the system inside you work, and you're not letting someone else program you. And if you need too many reminders, alarms to wake you up, to tell you what to do, then it means that, well, yes, you're not really up to the mark. Do you need an app to regulate or customize your meals? Then think about it. So I see a lot of people weighing the food that they eat in order to have lose weight and all of that. So you don't really need to weigh your food. You just need to regulate your appetite, which again, the ghrelin leptin mechanism is so beautiful in the body that you don't really need someone else to tell you how much to eat, because it depends on a lot of factors. It depends on your stress levels. It depends on the day, the place where you are, the altitude, the weather, a lot of factors, the humidity, the factors go on and on. So how disciplined are you nutritionally based on these simple points will tell you how good your heart is. So next is, when it comes to the salt part of it, so take it with a pinch of salt. So these are the facts, which again I've picked up from the WHO website. So I know most of you here know what is hypertension. So commonly called blood pressure, and in our normal language, layman's language. So basically it's nothing but it's accompanied, it's like buy one get one free. It's frequently accompanied by hyperlipidemia. So whenever you have an elevated cholesterol or an elevated LDL levels, blood pressure is something like that comes free of cost, like buy one get one offer. So coronary artery wall tension increases, so the arterial smooth muscle cells, there is hyperplasia, and that is why you have the hypertrophy. That's why making the fibromuscular thickening. That's the mechanism behind it, why it comes free of cost, right? So the main source of sodium is in our diet is salt. But having said that, it can come from sodium glutamate, which is used in many parts of the world. Maggie being a simple example, it has monosodium glutamate. And also sodium is naturally found in a lot of foods, because I get a lot of people who tell me that they don't really add salt, but still their blood pressure is going high and all of that. So sodium need not always be from salt that we eat. Some natural sources are milk, meat, and shellfish. So this is one more thing that we have to keep in mind whenever we are talking about the salt consumption. And it is found in high amounts in processed foods, which I don't think I should mention. So all the processed foods, whether it's your bread, whether you say it's multigrain, whether it's whole wheat, whether whatever you call it, anything that is coming in a packet, anything that is coming in a plastic always has sodium to it. Okay. And this is one interesting fact that I think which we all should pay our attention to. An estimated 2.5 million deaths could be prevented each year if global salt consumption were reduced to the recommended level. Okay. And reducing salt intake has been identified as one of the most cost-effective measures countries can take to improve population health outcomes. And key salt reduction measures will generate an extra year of healthy life for a cost that falls below the average annual income or gross domestic product per person. So the problem with Indian cooking is we don't really know how much salt we add. So thoda lo just add kar diya aise for taste, for something. Again, we are reheating, add little salt, add little masala. So I don't see, I don't say it's like totally wrong, but we need to kind of regulate the way we are cooking. So yeah, we have to take this with a pinch of salt. So salt normal versus after. So according to the American guidelines, which I really latest, which I recently picked up, they're even more stricter. They just say 2,300 milligrams per day, which is not even equal to 1 teaspoon, because 2,300 milligrams is just 2.3 grams. So which is not even 5 grams. 1 teaspoon is 5 grams. Okay. So their recommendation in America for the American citizens, according to the ADA, is lesser than 1 teaspoon. But the Indian recommendation says it's around 6 grams. So 5 to 6 grams is 1 teaspoon per day. But that 5 to 6 grams is only through, cooking and all of that. In addition to it, the biscuits that you eat, the waffles, the bread, the processed foods, one Lay's packet, all of it is additional. Okay. And after any, heart related issue, in any diet for heart disease, it is important to reduce your salt intake to less than 2.5 grams, which is nothing but, less than 1 teaspoon, which is just 2.5 grams. So red meat, processed foods, and anything that is deep fried is all part of the list of foods to avoid for, after a heart attack. So especially when it comes to red meat and processed foods, and I think red meat still in India, there are a lot of places where we don't really have a lot of red meat, but the deep fried foods, especially the evening 4 to 7 meal where all of us feel like having a kachori, a samosa, some singara and all of these, that is the problem, because they all have sodium in it. And that is the main problem, because more sodium intake, then there is more water retention. And I'm sure in certain heart conditions, you also have a fluid retention or a fluid restriction. So yes, so that's the normal versus after. But even otherwise, it's better that, but yeah, having said that, it doesn't mean you should not add salt in your cooking at all. Salt, normal salt in cooking is totally okay, but the extra, the packets that enter our kitchen in terms of, shave and that puri and this puri and kachori, samosa, biscuit, salt biscuit, that is the problem. So beware, this is a very important slide, which I would like, I think maybe all of you to observe. So whenever I see a lot of people who come and tell me, I buy all gluten-free, salt-free, fat-free, all free stuff, but it does not mean that they are free, okay? So what it says and what it means is a very important thing, right? Like there are a lot of things which we have to interpret on our own. So salt or sodium-free means that it is just less than 5 mg of sodium per serving, okay? So it's still, that's still a lot, like less than 5 mg per serving, okay? And it depends on how much you're eating at once. That also matters. When they say very low sodium, it's 35 mg of sodium or less per serving. When they say low sodium, then it's 140 mg of sodium or less per serving. And when you say reduced sodium, then it's 25% less sodium than the regular product. So light in sodium or lightly salted means 50% less sodium than the regular product. and no salt added or unsalted, which most of us fall for, like no sugar, no salt. It means is no salt is added during processing, but these products may not be salt or sodium free. So this is something that maybe you can take a picture of this slide, or maybe you can, write it down. But this is really, really important if you have people with heart conditions at home, or if you have people with parents or elders with um, hypertension issues, or cholesterol issues, or all of it, if you're in the marginal borderline, because this really, really is very important. Nutrition label reading is a big scam, and what they actually write and what we actually comprehend are two different things. So nutrition labeling or the label reading is very important. Sodium part, is salt part of it. So coming to the next one, like, are fats really fattening? Because we are done with, I think sodium. So the next important thing is the salt part. So the salt part is, these are the commonly, asked questions, like which I keep getting. Should we not have homemade ghee at all? Should we throw away cashews from our diet? Is it bad to have coconut with the meat inside? Someone told me that desi oil is bad and we should all switch to olive oil. I always choose fat-free foods because I don't want to put on weight. My neighbor doesn't eat yolk of the egg because it is fattening. I think all of us, in some or the other point of our life, at some point or the other, we all would have had these questions. Or even if we would not have, someone, some neighbor or some brother or some sister or some friend or someone would have told us these things. But let me tell you that fats are very important. Yes, fat is bad for health is a myth. The fact is, good fat are present in nuts, seeds, and certain fishes and all these olive oil and stuff like that, which nourishes the body and which lowers the LDL. But answering to these questions, you don't have to replace all the desi oil with olive oil. That's not what I intend to say. It's just that you need to look for an extra virgin or a virgin or an unrefined cooking oil. You don't really have to throw away your desi oils. Just replace it with an unrefined desi oil. You don't have to always choose fat free, because when they say it's fat free, there is a possibility that they're adding a lot of refined sugar to it, making it more sugary in nature. So you might be cutting down on the fats, but you're consuming more sugar. Okay. And my neighbor doesn't eat yolk of the egg because it is fattening. So, well, when it comes to the egg yolk, certain vitamins like A, D, E, K are present only in a fat soluble medium, and they can be absorbed also in the fat soluble medium. So yolk of the egg, when eaten in the right proportion, in the right quantity, is healthy. Should we not have homemade ghee at all? Again, that is a myth. Homemade ghee, again, underlining the word homemade, it's a rich source of butyric acid or butyrate, which is extremely good for your satiety levels, lowering your blood sugar levels, and for all the women there, for hair, skin, and all of it. Cashews, again, are consisting of good fats. So they are basically consisting of E, vitamin K, again, good for your skin, hair, and you don't really have to throw them away from your diet thinking that it's fattening. What really has to go out from your diet is the processed food. When people buy multigrain bread or wheat bread thinking that it is made out of wheat, but still when it has maida and adulterants added to it, when we are all eating pizza and chocolates and pastries as a cheat meal on a Sunday evening or on a Sunday afternoon, they are fattening, right? So fat intake, what to look for post heart attack. So many people post heart attack, they become extremely strict, extremely cautious, and they stop consuming any forms of fat. So do not rule out fats completely from the diet even after a heart attack. That's very important, because we have something called essential fats. Essential fats are required from our diet, okay? So which we need to, eat from the food. You have essential and non-essential. So which are really important from the food that we eat. So instead, switch to healthier fats, like I was talking about, unrefined or virgin cooking oil or homemade buttermilk or nuts and seeds in the diet. Okay. Instead of using vanaspati, dalda, all these, things, or the saturated fat, it's better you switch to healthier forms of fats. And the biggest contributor, in the fat mechanism or the fat regulation is the spices. So India is the richest we all know that India is the richest country when it comes to our cooking, especially with spices. From Kashmir to Kerala, I think the variety of spices that we get really changes every 100 kilometers. So name the spice and it has a quality to protect your heart. So garlic, I think most of us know. So all of us know garlic because of all thanks to COVID too, because of this garlic, mint, turmeric, cinnamon, cardamom. Now everything has become, very popular. So, but yes, include spices in the right quantities. Just because you have to eat garlic, don't start, with the turmeric water. I see people having turmeric water. I see people having cinnamon water. They are all fads. You don't need to have them in water. You have to have them in the traditional way that they're supposed to be had. Turmeric in normal dal, sabzi, or a glass of haldi ka doodh. Garlic in your chutney, garlic in cooking, ginger in all the tadka, in ginger in tea, ginger in maybe coffee, and also cinnamon in whatever sweet that you're making, or basically any with fat soluble medium like milk. So spices really aid in digestion and they help in the fat absorption. They help in lowering your blood cholesterol or your LDL levels. So they help in maintaining your fat levels. So red meat, processed junk, canned food, strict vigilance in that. So I'm not against a non-vegetarian diet. All I say is avoid red meat and try to look for leaner forms of meat, like whether it's chicken or fish, and try to stick to the local seasonal meat and not, have something which is processed. Okay. And very important, if you are already a heart patient and you have had a heart attack, then it's very important that you, along with your physical activity levels, you time your meals. Okay, the nutritional discipline is very important, and it's very important that there is no non-veg, or there is no sweet, or there is no oily food which is consumed post 7 p.m. Okay. And reading the labels, yes, because this is a big scam. You can always go wrong there. So reading labels and at least, having the right person to guide you for that is very important. And looking for protein and fiber combination is important, because what happens when you suddenly cut down fat from the diet, the satiety levels you might not feel really full. You might still feel hungry. Okay. So that is why you need to include good quality protein. That is where I spoke about your lean forms of meat, the egg whites, and, the lentils. The lentils, again, not extra lentils, but I'm talking about the normal balanced meal where you're having the rice, the dal combination, not extra dal and giving you bloating or gassy, gastric issues. And the fat recommended generally post surgery or post heart attack is less than 15% of total energy. So having said that, you need to customize it. So that depends on your non-modifiable risk factors like your age, your gender, your family history. And for that, you need to consult a dietitian or an expert. Okay. You just cannot do something which was forwarded to you on a WhatsApp or on a, some social media. So customization, tailor making stuff for yourself is very important. So nutrition management post-attack, vitamins, phytosterols, flavonoids, good fats, lean protein, all of this have to be there, which I've mentioned. Watch out for the physical activity level as per your cardiologist, how much ever you're permitted to do, and based again on your non-modifiable risk factors, whatever can be done. Water intake and the note on the salt intake, there are conditions where the fluid is restricted. So for that, the fluid restriction and your salt restriction comes into picture. Look out on the other comorbidities, because heart attack, just looking at one angle or one aspect is not enough. So you also need to consider your hypertension. If you have, you're most likely, there are chances that a person is having the comorbidities like diabetes, hypertension, hypothyroid, all of it. And follow an antioxidant diet. So antioxidant diet is something where you're including more of your local seasonal cooking. It's nothing like a fancy diet. It's more where you see a lot of traditional home cooked meals where you have a lot of vegetables, a lot of fruits, and you have more of local and seasonal stuff, and without more of processed foods in the diet. It's just nothing but you're eating fresh, you're eating on time, and that is your antioxidant diet, because that is what reduces your inflammation, the reactive oxidative stress, and all of that. That's it. So prevention is always better than cure. So this simple picture, I think I really like this picture. You have a heart, you have an apple, and you have a tablet. So always try to stay on the apple side so that you don't have to come onto the, tablet side. So how to prevent a heart attack? I think this picture summarizes it all. So alcohol has to go, stop smoking, sleep well, healthy diet. So for comorbidities, check your blood pressure, check blood sugar, exercise, lose weight. So that's simple, but again, from my perspective, what are the foods that make your heart? So badam gives you aram. So start your day with overnight soaked peeled almonds. Also, it's a phytosterol, like I mentioned. Peaches, cherries, kumani, lychees, berries, whatever, whichever region you stay in, seasonal fruits, feel free to have them. And make sure that you don't juice a fruit and it's always eaten fresh. Kokum Rasam Sharbat, this is very popular in Western Ghats, and I always have one kokum in every slide of mine, in every talk of mine, because this is really good in manganese, helps in improving bone health, and also reduces your inflammation. If you do not have access to kokum, then probably nimbu or a glass of roo abza. I think roo abza is your rose, water, which is very popular among the north. So, especially during summers, and if you get the actual good quality, the rose petal, that's really good. They're again consisting of vitamin A, B, E, and all of that. Homestead buttermilk is also a rich source of B12 for vegetarians. So bone, even if you have vitamin D deficiency, calcium deficiency, that's sorted in homestead buttermilk. Again, it's a phytosterol. So look for vitamin D fortified products, like you have vitamin D fortified cereals, oil, even the cooking oil that you get is fortified, can be, you have such provisions where it's fortified with vitamin D. Sabja seeds, laddu, or any seed, whether it's flax seed, whether it's sunflower seed, add them into cooking at least twice a week, either dry roast it or add it on the fruits, any possible way. Steamed fatty fish twice a week, or lean cut chicken breast, not fried, only the stew or the soup form. So if you're a non-vegetarian, or if you're a vegetarian, you can have protein bars. Again, label reading is very important. No trans fat or no saturated fat, just made of seeds and dark chocolate. Again, having said that, dark chocolate whose cocoa content is greater than 75 to 80%. Fermented, sauteed, and steamed foods over fried. So anything which is fermented, anything which is steamed, anything which is sauteed, anything which is homemade is always better over the packaged ones. Okay, so in a nutshell, from my view, eat adequate sleep and exercise gives you health and weight loss. Most of the times we're only looking at that bigger weight loss wala aspect, and we are losing out on health. Eating local, eating seasonal, and eating fresh. I think that's the simple mantra that all of us can include. So don't SSSS. So I'm not talking about those 4 S's. These are the, again, different 4 S's. Any diet that asks you to be on a soup, starvation, salad, smoothie, put it out. Any diet that comes with a name which is trending, put it out. Stress eating, skipping meals, asking you to eat a meal replacer, anything with hashtag, fancy stuff, just throw it off your diet. So the bigger picture or the final answer to anything is sustainability. So anything which is sustainable, anything that you can think you can do. Yeah, I think somebody has to mute themselves. So anything which you think you can do anywhere, sitting in any corner of the world, which is permanent, which is sustainable, follow that. Okay. An example, just to, put up everything, is starting your day with a fresh local seasonal fruit, having a good heavy breakfast with this kind of a protein normal combination. The staple combination is again advisable, like whatever it's idli, dosa, whether it's poha, whether it's paratha. Having a mid-morning, that's your phytosterol, that's your, buttermilk or nimbu pani. Having your staple food like your, roti or rice dal, or, any one serving of non-veg twice a week here is okay. Having horse gram, sprouts, dry coconut, puffed rice as an evening snack instead of a kachori, samosa, biscuit, so that you don't accumulate a lot of salt and fat. And having any millet is again preferred for dinner, so that you don't feel hungry and you don't have a crave to eat something in the middle of the night. And finishing your day with a glass of haldi ka doodh, so that you have a very sound sleep and you don't have trouble sleeping. So include these things: cashews, gourds, homemade ghee, chia seeds, flaxseed, and then I'm sure your heart will be in a very good condition. And thank you very much for a very patient hearing. And that's my Instagram handle, that's my LinkedIn, so you can reach out to me. in case, you have anything.
Yes, if you have questions, guys, please ask Sharanya. Anyone having questions? Okay, there's a question, I think.
So should we exclude processed food completely? So yeah, I mean, it's practically impossible to exclude it completely, because staying in a metropolitan city, certain foods are naturally processed. Okay, so what you can do is only regulate the consumption, where you don't really have to rely on a processed food like getting a biscuit packet or having some evening mixture, or something like that. Instead of cultivating such habits, you can try to regulate the amount of consumption of the processed foods.
Yes, any other questions? Any other questions, guys? I don't think so. I think all well. It was wonderful. Okay, Prajakta has the question.
Ma'am, we shouldn't add salad into our meal, that plate with 75% salad and 25% sabji. So whenever you're talking about salad, anything which is raw, which is uncooked, so I don't really suggest that for, its hygiene and for the kind of food poisoning and all that it can cause. So anything raw is not really preferred. And if you're talking about weight gain, weight loss, that's a different topic here, since it was about heart. So yeah, vegetable consumption is fine, but when you again eat excess of fiber, again it will give you bloating and gastric issues, and you will again feel very unfull, and you will end up craving for a sweet or a spicy or a tangy thing post lunch. But that is in general. So but when it is in a person with a heart ailment, then salad of the vegetable is important, but it's also important that you add little spices to it and you saute it or stew it, so that it's just not very raw. Okay, because you also need to do this for a longer time, and you need to keep in mind about the taste, and it has to be a little palatable. So give me weight gain. So weight gain is a different topic altogether. So here I'm trying to stick to only, the heart related things, because again, weight gain chart is, it has to be done in a person. It is a very customized thing.
And that I think we have discussed in the last classes as well, last sessions.
Yes, yes. So, well, I think that's it. And
yeah, thank you everyone, and thank you,
you
very much. Yes, thank you. Take care. Have a good day. Have a good weekend,
Thank
guys.
you.
Take
Have
care.
a nice weekend. Bye bye.
Bye bye. Take care, guys.